We turn now to the pandemic front and a sign of hope tonight. Springfield, Missouri seeing a significant drop in COVID hospitalizations just weeks after it was labeled the epicenter of the Delta variant in Missouri.
And that could foreshadow a positive turn here in the Kansas City metro. Take a look at some data from the Springfield Greene County Health Department, where COVID hospitalizations peaked July 23rd with 271. Today, Springfield's Mercy Hospital reported 89 patients, but the area as a whole is still in the red zone. Now look at what that may mean for the metro as we compare the trends in Springfield to Kansas City. Our area hit its highest hospitalizations on August 6th with 165 hospitalizations. The hope is we could see a decline in 2 weeks as well. While that snapshot of the numbers gives a sense of optimism, local public health experts stress we're far from out of the woods here.
KSHB 41 News reporter Andres Gutierrez joins us live from the University of Kansas Health System to explain. Andres.
Kevin, in the last few weeks, there have been less ambulances showing up here because they have had to turn away sick patients from other hospitals. And now there is a team in our area that only shows up whenever there's a natural disaster.
It's uncommon to see that in the Midwest.
A team of 13 medics and EMTs from 6 different states are in our area with a single mission: help with the surge of sick patients at hospitals around the metro. In your 38 years, have you seen anything like this?
Nothing that's been as protracted as this incident. I mean, 18 months of response and watching the ebb and flow of the pandemic.
Since arriving Saturday afternoon, the ambulance strike team is doing 4 to 5 transfers each day. Almost all of the patients are locals.
Everybody is at that capacity. And so we have to find other ways to help decompress the hospitals or provide support.
As a region, the amount of daily new hospitalizations because of COVID-19 continues to rise, on par to what it was over the wintertime, as is the case at the University of Kansas Health System, where there are 18 people in the ICU battling the virus.
It does impact how many patients we can take in on any given day, and we evaluate every single patient.
Hospitals in other COVID hotspots around the country, like Texas and Arkansas, are asking for assistance with patients, but
unfortunately, most of those patients can't come to us because they're too sick to travel. They're too unstable. And so we know that many of those patients will likely pass away.
The grim situation also playing out here at home.
We're scared because we know that maybe the worst hasn't come yet. And if we don't change our behaviors now, there's going to be a lot more hospitalization and death.
Now, Dr. Williamson did mention that in the short term, masking is the way to get this variant under control. The long-term solution, well, you've heard it before. Get vaccinated if you haven't already. Reporting live in Kansas City, Kansas tonight, Andres Gutierrez, KSHB 41 News.